Welcome to Pharmacist Michael's Happy Healthy Living. Today, we're going to talk about a medication called Spravato, which is a form of ketamine available as a nasal spray to treat patients with treatment-resistant depression. Now, let's break this down into simple terms. Depression is a condition that can make people feel very sad and hopeless. To help with this, there are medications that doctors usually give, like pills. These pills are supposed to make people feel better, but they don't always work, especially for those with really tough or treatment-resistant depression. But here's where things get interesting. There's a medicine called ketamine that was originally used for putting people to sleep during surgeries. Doctors found that when they used ketamine in some patients, it made them feel better from their depression really quickly. Imagine this. Traditional depression pills take weeks to make someone feel better, but ketamine can do it in just a few hours. It's like a superhero in the world of depression treatments. Ketamine also works in a special way. Instead of messing with things like serotonin and norepinephrine, which other depression pills do, it works on something called the NMDA receptor. This receptor is like a switch in your brain. When you turn it off with ketamine, it helps your brain make new connections and gets rid of the bad feelings that come with depression. The exciting part is that it works not only for regular depression, but also for the kind where people have really high mood swings. So, it's like a double win. But there's a catch. Ketamine isn't without its concerns. When used in the wrong way, it can be harmful, even addictive. That's why doctors have to be super careful when they give it to patients. Now, the even cooler part, they made a special form of ketamine called Spravato, and it comes in a nasal spray. This makes it easier to use than the regular ketamine, which needs an IV or shot. The U.S. Food and Drug Administration, or FDA, which is like the boss of medicines, approved Spravato for people with treatment-resistant depression. It's a big deal because it's the first new type of antidepressant to get this approval in a really long time. Spravato works in the same way as regular ketamine, so it's super quick at helping people feel better. They take it as a nasal spray, and it's usually given along with other depression pills to get the best results. But there are still some things to be careful about. Just like regular ketamine, Spravato can make people feel a bit weird for a short time. They might see or hear things that aren't there, feel confused, or get anxious. So, they have to take it under the watchful eye of a doctor and stay for a couple of hours to make sure everything's okay. Now here's the part where people discuss what's right and wrong about all this. Some folks worry that these treatments are too expensive and that not everyone can afford them. They also wonder about the long-term effects, like if people will get hooked on these medicines or if there will be other problems down the road. To make things even better though, scientists are working on new and improved versions of ketamine and Spravato that won't have these side effects. They're looking into different ways to give the medicine, like pills or dissolving tablets, so it's easier for everyone to use. In the end, the use of ketamine and Spravato is like a big step forward in helping people with depression. It's giving hope to those who haven't found relief with traditional treatments. But we also need to make sure that it's used safely and responsibly, and that everyone who needs it can access these treatments. The journey of these therapies is still ongoing, and they have the potential to change the world of mental health care, offering a bright light at the end of a tunnel for those battling depression. If you know anyone who would benefit from this video, please send it to them. If you have any questions about ketamine or anything else, please leave them in the comments section. Be sure to check out my other videos on depression. This is video number 4 in a depression series. And please don't forget to subscribe to my channel for more happy, healthy living information. My name is Pharmacist Michael. Be happy and be healthy.